The cardiac cycle refers to the electrical and mechanical events generated with every single heartbeat. Each ECG representation of the cardiac cycle consists of waves, segments, and intervals. There can be 6 waves on an ECG: P, Q, R, S, T, U. They appear as positive or negative deflections. Segments are the flat isoelectric lines between the waves. Intervals include both waves and segments. ECG paper is divided into large squares that are 5 mm wide, which are divided into smaller squares that are 1 mm wide. A standard ECG is recorded at a speed of 25 mm per second. The vertical axis measures the amplitude of the heart's electrical activity, so 1 mm equals 0.1 millivolts. The horizontal axis measures the time, and 1 mm equals 0.04 seconds. P wave corresponds to atrial depolarization. It is best observed in leads 2 and V1. The duration ranges from 0.06 to 0.10 seconds. The amplitude is less than 0.25 millivolts. Abnormal patterns of P wave: more than 0.10 seconds in duration with 2 lobes, left atrial enlargement; more than 0.25 millivolts in amplitude, right atrial enlargement. QRS complex corresponds to ventricular contraction. It consists of 3 waves, Q, R, and S. Q wave corresponds to the depolarization of the interventricular septum. It is the first negative deflection after P wave. The duration is less than 0.04 seconds. It is less than 20% of the corresponding R wave amplitude in D3, AVF, V5, and V6. It is normally absent in leads V1 to V4. R wave corresponds to the depolarization of the apex and lateral walls of the ventricles. It is the first positive deflection after P wave. S wave corresponds to the depolarization of the base of the ventricles. It is the second negative deflection of the QRS complex, or the first negative deflection after R wave. The duration of QRS complex ranges from 0.08 to 0.12 seconds, and the amplitude ranges from 1 to 1.5 millivolts. In leads V1 and V2, the amplitude of R wave is smaller than the amplitude of S wave. In leads V3 and V4, the amplitude of R and S waves is about the same. In leads V5 and V6, the amplitude of R wave is greater than the amplitude of S wave. Abnormal patterns of QRS complex: more than 0.12 seconds in duration, appears in bundle branch blocks. T wave corresponds to ventricular repolarization. It is an asymmetrical wave. The duration ranges from 0.13 to 0.30 seconds. The amplitude is less than 1/3 of the corresponding QRS complex. Abnormal patterns of T wave, such as inverted T waves, appear in ischemia. U wave corresponds to the repolarization of the papillary muscle and repolarization of the Purkinje fibers. The amplitude is less than 1/4 of the corresponding T wave. It is best observed when the heart rate decreases in hypokalemia and in leads V1 and V2. The two segments that can be seen on an ECG are PQ or PR and ST segments. The duration of PQ or PR segment ranges from 0.06 to 0.10 seconds, and the duration of ST segment ranges from 0.05 to 0.15 seconds. There are 4 intervals on an ECG. PR or PQ interval corresponds to atrioventricular conduction. It extends from the beginning of the P wave until the beginning of the QRS complex. The duration normally ranges from 0.12 to 0.20 seconds. The PR interval is prolonged in atrioventricular blocks, and it is shortened in Wolff-Parkinson-White syndrome. ST interval extends from the beginning of the ST segment until the end of T wave. Characteristic patterns appear in ischemic heart disease. QT interval corresponds to ventricular depolarization and repolarization. It extends from the beginning of the QRS complex to the end of the T wave. The duration normally ranges from 0.35 to 0.45 seconds. RR interval is the interval between successive R peaks of the QRS complexes, and it is used for heart rate calculation.